So this is our Module 8, our Safe Handling, Spills, Acute Exposure, Chronic Exposure module. All staff are required to be informed about safe handling of chemotherapeutic and hazardous agents. This is not just applicable to registered nurses, pharmacists. This also applies to our respiratory therapist, our dietary, our housekeeping, anyone that could potentially come in contact with a patient who may be receiving a hazardous agent. I just wanted to review with all of the staff the key components that for 20 years we really haven't had to wear or be involved with. 20 years later, just because it was good 20 years ago, we didn't know as much then as we know now. And really the Department of Health, NIOSH, which is the National Institute of Safety and Health, which is involved with the CDC, have come out with standard guidelines that overlap with each other in what we should be doing for safe handling. And this is the expected standard for practice. One of the comments that I know staff will commonly give is, I come at the patient and I come with a gown, and I come with a mask, and I come with gloves, and oh my gosh, I'm getting horrible drugs. Well, this is why they sign a consent. These drugs can cause damage to the DNA, so they can alter the cytogenetics of your DNA. These drugs can also cause harm. In people administering them, if they would become pregnant, can cause abortions, spontaneous abortions, loss of limbs in infants. This is all documented, proven evidence. This is why patients sign a consent specific to these agents. And here on our end, well, I'm not mixing, I don't have exposure. There's different ways to be exposed to these agents. There are aerosols, which means that those aerosols can be released through urine, through sputum, through sweat glands of people, and especially the higher toxic agents. So rather than try and figure out which agents cause it and which agents don't, safe handling is required for any patient receiving that. So if you are mixing the drug, if you're administering the drug, or if you have any chance of exposure of a patient while they're actively receiving that drug, you should have the nice blue gowns on and be explaining this to your patients, because this also applies to them going home and being around their family members. So we should be double gloving, as well as me, and gowning, and if necessary, additional equipment, which will be shown further down in the vignette. All patients actively receiving chemotherapy will have a hazard precaution sign posted outside of their door. So those departments that aren't actively administering and mixing chemotherapy would be aware, by seeing this sign, if you were a housekeeper, if you were dietary, if you were a visitor, to ask more questions before you would enter the patient's room so that you wouldn't be exposed to these patients to cause harm to yourself. In addition, any patient receiving this would have a yellow bin in the vicinity or in their room. So this would be the equipment that you would need. The additional piece that I want to reinforce with this is that some drugs are just hazardous, and not just, but they only really require you to be double gloving. So they don't require wearing the gowns, but double gloves. Chemotherapeutic agents, on the other hand, require gowning, double gloves. In addition, if you need extra eyewear, that's an option based on the drug you would be giving. However, it's mandatory that you are gowning and double gloving if you're administering chemotherapy agents. In addition to that, those chemotherapeutic agents are agents that have to have a double label and be double checked by another registered nurse. They're high-risk drugs. So for the nursing staff and the pharmacists, there are two different lists that we have. That pharmacy will have these lists. This list is a list smaller, which would be those agents that would require the gowning, the gloving, and the double check with another registered nurse. These drugs will come from the pharmacy labeled as such. It will say hazardous precautions, and it will also have a chemotherapy competent label on it, which means that it needs to be double checked with another RN. This list is the NIOSH list, which is safe handling, which would require double gloves, and it's just awareness for every nurse in every unit. If you got this labeled, it means that it's off of the NIOSH list, and it would require you to double glove before administering to the patient. That would go for subcutaneous injections, oral agents, IV agents, any type of agent, how that would be packaged in that manner. I realize this is a change in practice for things we haven't done in a very long time, and it is asking people to really wear hot gowns when you're administering all day long in the clinics. We can't see the chemotherapy. Just because it's not a viable spill doesn't mean that those aerosols aren't laying there. There have been tests done in the administration areas that it's around patients' beds. If you have a Foley that disconnects at the bedside and end up with urine on the floor of a patient receiving cytoxin, you are dumping cytoxin onto the floor, which then constitutes a spill. This really is meant for our safety. It's meant for the safety of our patients, the visitors, and this is what this whole module is about.
Good morning, Mrs. Smith. My name's Crystal. I'll be your nurse today. I understand that you're here getting chemotherapy for the first time.
Yes, that's correct.
Okay. Well, first we're going to place this yellow bin in your room so we can discard any chemotherapy products. And we're also placing this yellow sign on the door to alert your family and staff that you've had chemotherapy.
Okay.
All right. Thank you.
Good morning, Mrs. Smith. I see you're being admitted today for nausea and vomiting.
Good morning.
Oh, honey, how are you feeling?
Just a little sick.
Oh, well, we're going to get you better. We're going to get some stuff ordered. Let me just ask you some admission questions so we can get the ball rolling, okay?
All right, just be quick, please.
All right, I will. Have you had any chemotherapy in the past 72 hours?
Chemotherapy? What's that?
It's a medication that the doctor orders. It could be either oral or IV.
I was in the clinic yesterday in the oncology area and got some drug through my vein.
Okay. Well, you know what? Do you remember the name of it?
No, I don't think I do.
Okay, well, you know what, that's okay. I can call the clinic and find out what the name of that drug is that you received. If you did get chemotherapy over the last 72 hours, since this is in an oncology unit, I'll need to order a chemotherapy safety kit. And it just has an assigned to alert the other staff members what we need to do with your body excretions and things like that. It also has a yellow bucket that we would have and a yellow bag for your linens. And some gowns in case you would still continue to get sick, but hopefully we'll be able to give you some medication and some IV fluids and you'll feel a lot better in the next couple of days. Okay?
Okay, will I get a bed on the oncology unit?
As soon as one comes available, we'll get you transferred down there, okay?
All right, thank you.
All right, you're welcome.
Okay, Mary is going to review the PPE guidelines of gloves, gowns, respirators, eye and face protection for the mixing of chemo, the administration of chemo, and handling any body fluids. The gown must be disposable, lint-free, low permeability fabric with a solid front, long sleeve with wrist cuffs so they can be tucked under the gloves. These are single use only. Discard the gown if it becomes visibly contaminated before leaving work areas and after handling of chemotherapy. The gloves must be disposable and are powder-free, have been tested for use with chemotherapy or biohazardous medications. WAPON will use the purple gloves, and all other facilities will be using the green gloves. Respirators, you should wear a NIOSH-approved respiratory mask with any risk of aerosol exposure or clean and spill. Do not use surgical masks. Eye and face protection. If you don't wear glasses, you can always wear eye shields or a face shield. Mary will demonstrate now how to appropriately put on the gloves and gown.
The first pair of gloves must go under the gown, so you put those on first. Put the first gloves on all the way up, with long sleeves. Then you put your gown on, completely over the glove. Ensure that the gown is clasped in the back. Make sure that you are tied. This is the point that you would want to put on your respirator if you need to, but we'll wait till the end to do that. The second pair of gloves goes over top of the cuff. This gets a little tricky, but can be done. Pull it all the way up. Get that completely covering the cup. You still do have some, if we can get it all the way up. You still have some dexterity, and you can still feel. Now, if you want to, at this point, you can put the respirator on. If you wear glasses, I recommend you take them off before trying to do this. We find that if you put the chin part on first, you can put it on easily. Usually easily. Try it again. And then pinch the nose. And then you can put your glasses back on and see. And that's all there is to safely dressing to safe handling chemo.
Just remember, gowns are single use only. After you have used it, you discard it and put a new gown on for the next patient or the next mixing.
Now, one thing we do have to talk about is taking this off again. Gloves come off, you pull them off into themselves. Pull that into one hand and pull it into itself again so that it is safe and no chemo is on the outside. And then you can safely take off your gown. And that is it.
Ma'am, you had a reaction to your Taxol infusion, so we had to stop it and stabilize you. But we spoke to the physician, and he had decided not to continue with your Taxol infusion.
Oh, okay.
Hi, Rick. My name
Hello.
is Rochelle. I'm a pharmacist, and I'm coming to get your chemo. So since there's greater than 3% of the drug left in your chemo bag, I'm going to go ahead and have you double bag that for me.
Okay, thank you.
And I'm going to take it back down to the pharmacy to the IV room and dispose it in the black waste disposal bin and log it out on the waste log. Now, if the patient didn't develop this reaction and she was able to tolerate the whole infusion, then you would just be able to dispose the chemotherapy in the yellow waste bin in the patient's room.
Any medication remaining in the vial after mixing must be disposed of in a black hazardous waste container. Chemotherapy which has already been mixed and cannot be administered to the patient for any reason must also be disposed of in the black hazardous waste container. Chemotherapy which has been connected to the patient for any length of time, which requires disposal, is considered biohazardous waste and must be disposed of in the yellow biohazardous waste containers.
In the clinical areas, all chemotherapy and biohazardous medications will be stored in areas of limited exposure in the pharmacy or on the clinical unit. Chemotherapy hazardous warning labels will be provided to be placed on the bins or the drug containers, as well as the shelves where these agents are kept. At home, we want you to keep the agents out of the reach of children, store them in a puncture-proof container that has a lid and has also been labeled with these biohazardous labels. Spill kits will be provided by the agency that provides the medication, and written instructions for the handling and storing of these drugs at home will be provided by the agency who provides the medications.
Mrs. Smith, your chemotherapy is disconnected. What happened?
Well, I don't know. I was just scratching my arm, and I guess maybe it came apart.
Okay, well, I don't see any on you, so just stay put for a minute, okay? Don't touch anything, just stay where you are.
Okay.
Mrs. Smith, I'm back. It's Heather. Honey, I brought a chemo spill kit. I let my other colleagues know that this is what's going on. I'm going to use you for a table, honey, okay? You just stay put. I'm going to get it all cleaned up. It's a nice small spill. Well, not nice, but it's a small spill, so that's good. I can clean it up myself. It was only about a teaspoon, which is a small area, so I can do that myself after I apply all my protective equipment, okay? I'm going to put my gloves on first, as you see. All right? I'm going to put my gown on. No one else should be coming in here unless I need some help right now. All right? So if any family members come, they need to stay outside for just the time being while I get all ready, okay? And get you all cleaned up. So you were just scratching your arm and you didn't feel anything?
No, I didn't.
Okay.
I'm sorry.
Oh, that's okay. This is an accident and these things happen. is why we have things in place so we know what to do when accidents happen. Okay, so you just stay put. I had to put all these things on, a gown, foot covers, because I don't want to step in that chemotherapy. I have your chemotherapy stopped, so no more is infusing into the floor. That's too important to be going there. It needs to go into you. I need to put a mask on so that way I don't breathe in any of the aerosols from any of the chemotherapy. And that's just because I'm exposed to a lot more chemotherapy than you are over the course of the years.
You do what you need to do.
Pardon me?
Do what you need to do.
Okay, thank you. All right. I may sound a little muffled, but that's just because I have on my mask now. We're almost ready. It takes a while to prepare to get ready to clean this up. This is a small spill, and I can take care of this myself. I'm going to take the absorbent pad and place it directly over top of the spill, and I'm going to let that absorb on there, okay, for just a minute. The other thing I'm going to do is get a plastic bag, which I have right here, and I'm going to place the rest of the chemotherapy into this bag. That way I can take it down to the pharmacy so they know how much medicine you have gotten and how much medicine you haven't. The girls out at the nurse's station have already called your doctor to tell them that this has happened because they need to be aware of that as well so we can know what to do as far as further orders. We've also called our director of the unit to let him know. I've already told you the other staff are aware because I don't want them coming in unless I need help. Okay?
Okay.
All right. Now, if I would get any more chemotherapy on your skin, I would have to take care of that by cleaning it. If I would get any chemotherapy on your bedding, I would have to get rid of that bedding and put it in my yellow bin as well. All right, chemotherapy is all collected. I'm going to set that aside. All right, I think it's pretty much absorbed from the pad, and I don't think I need anything else. Nope, I need to put my sign up so that no one else comes in the room. I believe that's all picked up. I'm going to... Hi, Mrs. Jones. I just came in to check on you.
Hi, Heather.
Honey, did you get up and go to the bathroom, or did you spill your water?
I had to go really bad.
Oh, okay. All right, well, just stay put, and I'll get you cleaned up. I don't want you to get down because I need to get this cleaned up. This is considered a large spill, okay?
Oh, I'm sorry.
Oh, that's okay, honey. I need some help.
Okay.
What's up, Heather? Anna, she had a little accident on the floor, and she just had chemo yesterday. So could you call the emergency number and just let them know we had a large chemo spill while I get this tidied up?
You want to give me the sign real quick, and I'll place that outside the door for you?
Yeah, great idea. And can you also grab me some linens because I need to get her cleaned up.
Okay,
too.
I'll call the emergency number, and I'll be right back with the linens.
Okay, great. Thanks. All right, Mrs. Jones, I want you just to stay in bed for now, okay? And then I'll get you cleaned up as soon as I get the spill contained, okay?
Okay, I'm sorry again. I really had to go.
Oh, honey, that's okay. Next time I want you just to call for assistance so that we can make sure that you get to the bedside come without any problems, okay?
Okay.
Plus, if you're that weak, I don't want you to fall either. So we need to be safe.
Is this going to take long?
Really, it won't take that long. The emergency people should be here shortly. But in the meantime, I'm just going to contain the spill. And then I'm going to get you cleaned up. Do you have any burning or any pain between your legs or on your legs?
No, I don't feel anything.
Okay, well that's normal. You probably won't. But after I'm done containing the spill, I will get you cleaned up, okay?
Okay, well hurry up because I really got to go again.
Okay, I will. I will, honey.
Heather, I'm getting the linens, but I wanted to let you know the emergency team's on their way up. They should be here shortly. They said to just get started, throwing some stuff down, and they'll be here.
Okay, great. I'm going to get her, yeah, and I'm going to get her cleaned up.
All right, I'll bring your linens in a second.
All right, thank you. All right, Mrs. Jones, I'm almost done, okay? I
Are
think
these people gonna hurt me?
Oh, no, they're not going to hurt you at all. Really, they're just like housekeeping. They're going to come in and they're going to probably put the same types of things that I have on, okay? And then they are going to take all of these pads that I put on the floor and put it in this yellow bag. All right?
Okay.
All right, so that's there.
Oh, my name's Heather, and I also called housekeeping to have them come up for the backup to help out for the emergency team, and they're on their way down the hall now.
All right, great. Thanks. All right, Mrs. Jones, I'm just going to get some soapy water so we can get you all cleaned up, okay?
Good afternoon. My name is Mark Henley, and I'm Manager of Environmental Services at Forbes Regional Hospital. And I'm here today to discuss with you how to clean up a chemotherapy spill on carpet. While it may be a rare occurrence, we all need to be educated on how that occurs or how you would take care of that spill. The first thing that you want to do when there is a chemotherapy spill on a carpet is contact the pharmacy department and environmental services department for assistance. We want to determine whether the chemotherapy spill is hazardous or non-hazardous. If it is deemed hazardous by the pharmacy department, then there is a special cleanup procedure that needs to be followed. If it's non-hazardous, what you want to do initially is you want to block off the area, secure the area with a sign, and make sure that people are not entering that part of the area. And then, of course, you want to wear your personal protective equipment, and you can see that I have on the personal protective equipment, which includes the double gloves, I have the gown on, I have the booties, I have my respirator, and I have my goggles. And that's very, very important. So I'm going to go ahead and put on my respirator mask and my goggles, and I have the area secured. So the first step that I am going to do with the chemotherapy spill here is I am going to get an absorbent powder that is located in your chemotherapy spill kit, which you can see right here. It has all the things that you need in order to clean up a chemotherapy spill, either on hard surface or carpet. There is a powder that is in your chemotherapy spill kit that you will sprinkle. The spill is right in this area right here, and I'm going to sprinkle the absorbent powder on this spill. And then I'm going to use a vacuum, wet dry pickup, to pick up this spill. And I'm going to cut it out. It's going to be a little noisy, but you'll see that this is the procedure. Okay, I think you get the idea of how you would clean up the spill. As I said, environmental services and pharmacy, as well as the nursing unit personnel, need to be involved in this operation. And once you have the area, the spill cleaned up, environmental services will do another clean of the carpet, and then you're free to release that area back, to the public and the patients. Okay, thank you for your attention today. The final step that you need to take is you need to dispose of your personal protective equipment in the yellow designated chemotherapy container, which is over here. So I'm going to throw away my mask, my goggles, I'm going to take off my gloves and my gown, and dispose of, and my booties, in the container so that it can be properly disposed of. So thank you for your time today.
Good morning, Mrs. Smith. My name is Cheryl. I'm going to be your nurse today. I see you have some emesis here. Not feeling very well?
No, I didn't feel very well last night.
Okay, for the first 48 to 72 hours, we use special standard precautions when handling any emesis from a patient who's had chemotherapy. We'll use protective gowns and gloves. and I have them right here. I'm going to take your emesis and throw it away in the bathroom in the toilet. But in the meantime, I'm going to put a plastic back absorbent pad on there in case anything was to flash. I'm also going to give you some of these when you go home in case you get sick when you get home. After I get you all cleaned up, then I'll go out and give you some medicine that'll help you feel a little bit better.
Okay.
These are the gloves we use. I'll also give you some of these when you go home. And when you go home, I want you to double glove, which I'm going to do also here. Okay, I'm going to go dispose of this and get you some medicine, and I'll be right back. Hi, Mrs. Smith. My name is Cheryl. You're going to be going home. I'm going to give you some discharge instructions to take with you since you have had chemotherapy. You will get a copy of these along with your discharge instructions when you leave. If you would happen to get sick while you're at home and you would have to discard of any emesis, I'm going to give you some gloves to take with you. If you would have to dispose of anything down your toilet, I'm going to give you a plastic-backed absorbent pad that you can lay over your toilet seat. If you would happen to get sick on any of your clothes, I want you to always place anything in a pillowcase. And then when you wash that pillowcase, I want you to wash it in hot water with regular detergent. I'll also send home a chemotherapy bag with you in case there's some things that you've just ruined because you've been sick, and you can put them in this bag. You can also take this bag to the doctors with you when you go back. Any questions you have for me?
No, not right now. Thank you very much.
Okay, thank you.
Margie Leslie. I'm the Director of Clinical Services for the West Penn Oncology Network.
Hi, I'm CJ Boyles. I'm one of the nurses at our West Penn Outpatient Oncology Network. I work in the clinic in our Mellon Pavilion.
We'll be presenting to you today information specific to exposures with the new chemotherapy standards. We'll be starting with acute exposures, also discussing chronic exposures, as well as medical surveillance. We'll be presenting this information in the form of some role play, as well as discussing the expectations of the new system guidelines.
Margie, Mrs. Brown had her chemo come loose, and I have it on my hands.
Okay, what we need to do is we need to get you immediately to the sink.
Okay. Margie, could you turn the water on for me?
Certainly.
Caught my
So at this point in time, the employee needs to wash their hands thoroughly with soap and water. And we will also expect that typically there may be auto sensors so that the employee wouldn't need to touch the soap or the faucets as well, the knobs. So once you wash this thoroughly with soap and water, then we will take a minute to review the MSDS sheet online to assess if there are any other additional steps which are required. All right, CJ, now that we've looked at the MSDS sheet online, we also would need to keep in mind if you'd had any splashing into your eyes, we would need to flush your eyes thoroughly for a minimum of 15 minutes with the water or isotonic saline solution. And then if you had any inhalation exposure, we would also need to seek emergency medical treatment in the emergency department or employee health. And then any accidental ingestion exposure, we refer to the MSDS sheet to see if what the management of that exposure would entail.
Okay. I will make sure that when I go home I wash my clothes separately and separate laundry because of possible chemo spill on my clothes. And I'll make sure that I do an occurrence report online, which is required for us to do.
Great. And make sure you take your clothes home after exposure in that sealed plastic bag. Don't forget.
Okay.
Okay. CJ, I just need to be sure that you're aware of what is required in relation to medical monitoring for employee exposures. Do you understand the expectations?
Yes, I know that we do need to complete that annual questionnaire to assess for potential exposures. I also know that any employee who experiences an acute exposure to yourself of any chemotherapy or biohazardous drugs need to complete the employee occupational injury or illness report, and it's going to be evaluated by the employee health office. They'll do a baseline treatment, and then they're going to do a follow-up for that, depending on the nature of the spill. If any exposure occurs and the health office is closed, I know that I need to seek attention at the emergency department for evaluation and treatment, and then follow up with my health office.
Yes, that is correct. If there's an emergency department connected to your facility, you can seek treatment there if employee health is closed, if it's after hours. For the off-site locations, they would need to contact their manager and make arrangements to be seen in employee health as early as the next business day, unless there's something requiring immediate urgent intervention per the MSDS guidelines.
Yes.
Right. There are also some pregnancy recommendations which are included in the policy, and personnel that are involved with handling chemotherapy or any other hazardous medication need to be fully informed of the potential reproductive risks. And the employees who are pregnant have the option to, or suspect they're pregnant, or who are breastfeeding, or even men who are trying to conceive, can make a written request to their supervisor in writing requesting duties that do not include management of these medications. And that will be considered on a one-on-one basis.